This is news that's coming in. There's more trouble, it seems, for pharma major Ranbaxy. Apollo Hospital has temporarily stopped the use of Ranbaxy drugs at its stores for a day. Apollo says it will wait for recertification from Ranbaxy first. Earlier, Jaslok Hospital in Mumbai stopped using Ranbaxy's drugs. The troubles began a fortnight ago after the firm agreed to pay a fine of $500 million for fudging of data and failing to meet American drug testing specifications. The Indian Medical Association has asked the Drugs Controller General of India to investigate the quality of Ranbaxy drugs. We're trying to find out more on how long this ban stays in place, the ban that has been put in place now by Apollo, which is the second group after Jaslok in Mumbai to stop selling Ranbaxy drugs. Amrita Tripathi joining us for more on this. Amrita, what do we know? How long does this ban stay in place, and when can we expect that recertification?
We're told that they're expecting it in a day or so, and rather than a ban, I suppose we should say it's an internal memo that's been circulated to halt the use of Ranbaxy drugs. Pretty much what we saw in Jaslok as well. Apollo Hospital this time not ready to make a statement officially. In fact, they didn't really want this news to come out. Last we had heard they weren't going to issue any such statement, though now we're expecting an official statement from them. And Ananya, they're expecting to see that recertification, they say, within a day or so, and we should say that other hospitals we're speaking to so far not taking a call either way, because they're waiting to see what happens in terms of the Indian drug regulatory authorities, waiting to see whether the health ministry steps in and says something about Ranbaxy, or if the Drug Controller General of India, in fact, carries out its review as is expected when they're supposed to review periodically pharma companies. And you'd expect them to wake up to something like this, given the amount of unwelcome attention that Ranbaxy has had to face in the past few months.
Amrita, just take us through who's responsible for issuing this recertification.
That's something we'll have to track with you. We're waiting to see whether how Ranbaxy also reacts, Ananya, because Ranbaxy has said all along that they've cleaned up their position, that they have a clean chit, essentially according to them. We do know that, of course, that there is no red flag when it comes to India itself. Again, we should remind our viewers, this is a reaction, some in the Maharashtra of FDA calling a knee-jerk reaction by hospitals, because it tracks to a US settlement that dates back to 2006, 2007, so not even drugs that were inspected here in the country. The DGCI and other drug regulatory authorities, in fact, are tasked with carrying out periodic checks of all pharma companies and so on. But something we can tell you by pharma analysts across the board, they say that needs to be stepped up and quality control needs to be enhanced in this country. They say it's not just Ranbaxy, in fact, it's other big companies that need to invest in this sort of infrastructure.
All right, Amrita Tripathi, thanks very much. As you're saying, we've got one reaction from Ranbaxy. Of course, the firm maintaining that their drugs are safe. Its CEO, Arun Sawhney, was speaking to CNNIBN's deputy editor, Sagarika Ghosh, earlier this week.
US FDA had issued an advisory advising the patients in the US to continue taking Ranbaxy medicines because they did not find anything wrong with the quality of the medicines. There were certain past practices in documentation and testing of the stability samples which had to be corrected. I can assure you all that has been corrected. We have taken all the necessary steps. Going ahead, we will ensure that the company operates with very high standards of professionalism and integrity.
All right, let's turn to the other top focus, and this is the IPL spot fixing.